Okay, good.
هي بعتت أكثر من واحدة، هم الثلاثة دول. يا هم أيوة الثلاثة نفس الشيء.
لا احنا تبعد تبعد.
هي دي اللي تشتغل تمام.
قبل ما خلصت.
تبسمي هتحمل خديها بعد.
ماشي باخدها يعني هو اصلا مهنج.
Again, the computer problem solved or not yet? هنحتاج نجيب بقى
هي مش تقيلة قوي بس
خلاها المرة الأولى. أيوة هي خلاص.
أبدأ؟ أوكي تمام. Assalamu alaikum. Good afternoon. My name is Khaled Younis. I'm the CT Sales Manager for Middle East and Africa. I want to thank you for the opportunity for me to come here and talk about a unique CT solution that is tied to the patient care idea. So today I want to talk about a solution in the CT industry that is catered for patient, for radiographer, and for radiologist. A solution that is away from technical specification, from resolution, from detector, from X-ray tube. We feel in GE we have reached very satisfactory levels in terms of the technical resolution and technical aspects and elements of the CT industries, that there are some elements that are overlooked, elements that cater to the real issue of patient care. And these elements have a lot of doors yet to be opened, especially when we embed AI in these technologies, in workflow, and in reconstruction engine. My topic today is about, it's called Effortless Workflow. It's a technology to streamline the whole CT process from beginning to end. A process that will give back the time to the radiographer, to take away a lot of the hard decisions that can do mistakes. Give him back the time to give back to the patient, to elevate the patient experience, to make the life of the radiologist much easier, giving him a consistent outcome in terms of radiation and image quality. And the way we, GE, have reached to this point and identifying this problem was very unique. We spent 2 years dealing with customers, working with customers, and identifying their biggest pain points. And believe it or not, we discovered that 85% of the customers, their biggest motivation and biggest problem is not technical aspect. It is operational efficiency. And this is where we decided to do something about operational efficiency and create a unique AI-based solution to solve for the biggest problem a department can have within the CT examination. If we look today at the CT examination, it is very tangled. It's very complicated, a lot of decisions, and these decisions can lead to a lot of mistakes. Mistakes can affect the diagnosis accuracy of the patient, the experience of the patient, and the overall workflow. But what if we can embed AI and make it streamlined, categorize it, make it into steps to make it easier, more efficient, and embed AI technologies to make sure this is done consistently and improving and fixing a lot of the mistakes that is happening in day-to-day workflow. To untangle it, we divided the CT examination into 3 steps. The first step is pre-scan, then during the scan, and then post the scan. And in each step of these 3 segments, we embedded AI-based technologies to enhance the workflow. And these are the 5 steps, which is we call, the first one is intelligent protocoling, the second is auto-positioning, smart plan, auto-prescription, and smart DMPR. And let me take you one through one and how this is happening. Intelligent protocoling. What is happening now, the patient comes in for a selected exam. The radiographer goes through lists and lists of different protocols, try to select the correct protocol for that patient. It's taking him time to select the right protocol the first time. He might do a mistake and he might scan the patient with the wrong protocol, impacting the overall outcome. So what if intelligently using AI and utilizing the historical protocols used within the department, when we select the patient name, automatically a list of 3 or 4 dedicated protocols for that patient comes in on a screen, and you select one of 3 or 4 protocols. It's much faster, more accurate, and intuitive. After the protocol is selected, and this is the most important point of a patient CT examination, is centering. Centering, believe it or not, is very, very important, and it's the most common mistake that can happen during the CT examination. We did a study, and we studied in a customer, and we discovered that 95% of patients being centered on the CT have patient errors and mistakes. They are out of center. And out of center, 2 to 4 centimeters can increase your radiation dose up to 30%. A huge amount of radiation dose only with a small issue. To overcome it, the system has a camera above the patient. It will look at the patient. It will look at the selected protocol we selected on the step before. It will automatically elevate the table to the perfect ISO center, centering the patient automatically in the perfect centering, putting the patient inside the gantry of the CT to start the CT examination in the perfect start position, ending in the perfect end position. Making sure not just the patient is perfectly centered, but making sure also we are not scanning over the area where we want to scan, keeping a very conscious decision to scan only the needed area so we don't over-radiate. Eliminating this extra increase of radiation dose, which ultimately impacting the diagnosis accuracy and the image quality. Patient after patient, we are guaranteeing this consistent radiation dose and auto-centering. Also, after the centering is done, the system will automatically select the start and end position of the scan according to the protocol selected. So now the radiographer does not have to go and manually select the region of interest, and maybe he can do a mistake, scan a region above what we need. The system automatically will select this for him, all done in in split seconds. My favorite part of this technology, something called auto-prescription, and this is very vital to the scanning examination. Now we have centered the patient perfectly. We did the scout, the camera, and the system has the full information of the system. Currently, in real life, every patient and the parameters for each patient are based on selected parameters, which is mainly catered to weight and protocol. But a patient of 60 kg can be different in the way his body looks from another patient of 60 kg. So utilizing only one set of parameters for all these type of patients will not give us the best result. We need a technology that will give us a parameter specific for that specific patient. And this is where auto prescription comes. Utilizing the information we get from the camera and from the scout, the system automatically suggests for us all the scanning parameters based on that specific patient, utilizing a set of presets, protocol management and parameter management embedded in the system to be applied on different patients even if they are at the same way. So the patient automatically select all the CT parameters, KV, MA, rotation speed, noise index, radiation reduction information, and even pitch factor. And all this done automatically is now the decisions that the radiographer is going through day by day, suggesting and thinking what parameters I need to use for this patient. We took it out, took the stress out from him, giving him back the time, making sure he's not making mistakes that can increase radiation dose and affect image quality that essentially affect the diagnosis accuracy of that specific patient. After this is done, the system reconstruct all the needed information, all the different reconstruction algorithm, or automatically sent to the doctor, and now the radiologist is sitting reading 20, 30, 40 patients per day, all within the same consistent image quality and radiation dose. The doctor who's reading 20, 30 abdomens, they are equivalent to each other. They're not at the different image quality, they're not at different all over the scale, so his workflow will be much easier, much more comfortable, and the overall diagnosis for that specific patient will be even more accurate. And this technology, it applies even to the most difficult examination, even through cardiac examination, where we need to do the auto-gating and check for the heart rate and check for the heart condition and the patient condition. The system is smart enough to take all this information and suggest for us the perfect cardiac protocol to be utilized depending on the patient heart rate, heart condition, and what protocol we need to select it. The camera will do all the job. It will suggest for us everything, and cardiac is the most difficult exam to be done. And a lot of failures happen in cardiac where it is non-diagnostic. So we want to go away from a non-diagnostic image to diagnostic all the time. In addition to this technology, our systems embed a lot of fail-safe technologies to allow us to do the cardiac examination perfectly every single time. We are now at 99% accurate diagnostic for cardiac examination, going up from 80 to 85, which is a huge increase and productivity in terms of cardiac examination. Let me show you how this technology works. It's very impressive. We scan the patient through the barcode, we select the patient, the protocol, all done in split seconds. The camera is looking at the patient, and it suggests for us where the scan start in positioning. We select the positioning button, the table is going perfectly to the perfect ISO center, and go inside the gantry to the perfect start position of the scan. So far, the technologists did not have to do any decision. We go inside the gantry and we do the first scan of the scout examination. The scout examination is done. The system automatically suggests the start end location for the axial examination. We agree. We go move the table back to scan the axial. The examination is done. Reconstruction in real time. Reconstruction timing. Scan examination is done. Seeing this and thinking how we can apply it into our busy department. Imagine you have 50, 60 patients per day. 50, 60 patients per day that you have to make decisions. Decisions that can be crucial to the diagnosis of that patient. Decisions that if they are made incorrectly, that can be the difference between finding a pathology or not. And applying this and giving the time to the radiographer, to give the time back to the patient, to end up with a perfect result every single time, this is where we're going through the technology. For the first time in the CT industry, GE put itself in the shoes of the customer and the patient, where nobody else did this before. And we wanted to create a solution that caters for the patient and the doctors. Technology is not everything. Technology, we have reached a way to allow us to improve radiation dose. We don't need to go lower than what we have right now, because now it's taken away from more important things. But let's focus about the patient. Let's focus about the outcome. Let's focus about the efficiency of the workflow. Imagine of the training headaches we are eliminating. Imagine of the turnaround of the patient. Imagine of how the KPIs of the department will change, utilizing a very simple solution based on AI that can help the overall patient, doctor, department, and the overall experience. In terms of numbers, and numbers are important, we are saving 66% reduction in clicks compared to the traditional way of scanning. 90% accuracy of protocol suggestions, and my favorite is 94% accuracy in auto positioning. 94% of patients are getting the correct dose, the best image quality outcome that comes from auto centering. Time savings of about 56% mean can translate to more patients can be done during the day, and 21% saving of entire examination compared with the traditional scanner. This is where we're heading. This is where we're embedding AI. This is part of where AI is going, and we have other technologies in terms of dual energy and AI reconstruction, but this is a crucial steps in the current industry. Thank you very much.
Thank you very much for your presentation. Any questions? There's one question here.